Okay, good morning, everybody. This is AAMI News and Conversation, and we're here at day 3 of AAMI FDA neXus 2024. I'm here with Jeff Smith of ONC, and for those who don't know, I'm about to ask Jeff, what is the ONC?
All right, well, thanks, Brian. The ONC is the Office of the National Coordinator for Health Information Technology. You can understand how we want to shorten that to ONC.
And this is very important because as of only a couple weeks ago, the ONC released a new final rule or regulation, the HTI-1. Now, what does that acronym stand for as we make our way through acronyms?
All right, so yeah, that is the Health Data Technology and Interoperability 1 final rule.
Mm-hmm.
So we've got a series of these HTI rules that we've been working on with different emphases.
And this is the first of them?
This is the first of them. And this one in particular is focused on AI and ML-driven predictive decision support.
Okay. Now, on Tuesday, so technically before the AAMI neXus conference actually started, we had several pre-symposiums. One of them was all about AI in healthcare, and Jeff was one of our presenters talking all about that. The final rule was part of that discussion. Can you tell me a little bit about what that is touching on now? And then, I guess, since it's the first of several, what else is to follow?
Okay. Yeah, so, I think ONC's regulatory authorities essentially extend to electronic health records, which are used by 98% of hospitals and just about 80% of office-based clinicians. And over the last several years, we've seen a proliferation of predictive models and algorithms that are used to predict everything from sepsis to heart attacks to patient no-shows. And the electronic health record has played a central role in all of this. And so we've taken a number of years to look at what can we do to optimize the use of predictive algorithms in healthcare. And one of the things that we determined was we need to improve the trustworthiness of these algorithms. We need to improve and shine a light on the quality of these predictive algorithms and honestly help users make determinations for themselves about that quality.
And when we talk about trustworthiness, this is whether or not the health system, whether the clinicians trust the program that they're using?
Exactly.
Okay. I'm very curious, and how did that all come about? Did you notice, oh, hey, these clinicians don't want to use these powerful programs despite the benefit of them? Is that how that works?
That's a part of it. That's
okay.
a part of it. There's a real hesitancy among clinicians and patients to use these algorithms, I would say, to optimum benefit. And there's good reason for that. Mm-hmm. There have been a number of studies done over the last several years that have really underscored the potential for these algorithms to really produce benefit, but also produce harm at a scale that is just unfathomable in a pre-electronic health record world. We're talking about racial bias on the order of millions. We're talking about inaccurate predictions on the scale of millions. And so that's where some of this hesitancy comes from. There's also just kind of a basic, I would say, lack of literacy when it comes to the use of these technologies. And so it was with that in mind that we really tried to use our authorities to make an impact.
Yeah. So let's talk about that impact. How do you ensure that a AI-driven program, an AI-driven medical device is worthy of a health system's trust?
So the logic model that we undertook with this program was that if we can bring transparency to the data that are used as part of the predictive model, if we can bring transparency to the performance of the predictive model, and if we can bring transparency to the kind of organizational competencies of those that develop predictive models, then we can help improve the trust. And we can also help users think about what is a high quality model. And in healthcare, what we came up with was this quality framework of sorts. Because once we think about a high quality model, you think, okay, well, what does that actually mean? And for the purposes of our regulation, and I think a way that we help conceptualize high quality from low quality, is we ask, is the algorithm fair, appropriate, valid, effective, and safe? And that those FAVES principles, or that FAVES kind of quality framework, really has been the driver of some of the more technical requirements that we've got in the program and have included as part of HTI-1.
Got you. And you had raised during the pre-conference a common question that you get, which is, hey, isn't the FDA already on top of this? Why is the HSS asking ONC to be part of it?
Right. Yeah, absolutely. And I think one of the things we did early on was talk with colleagues at the FDA, the Center for Digital Health specifically, because they had, at the time, they were working on finalizing the CDS guidance. And of course, CDS, clinical decision support, that is a really important piece of an electronic health record. And actually, what we call decision support interventions is a kind of the same but broader in scope than CDS. And so, we worked really closely with them to determine what kinds of information could be useful for both of our differing authorities. So, ONC regulates electronic health records for transparency in this space, and FDA regulates medical devices for safety and effectiveness. And I think those are clearly complementary, but they're distinct and different.
That's the fair point. And for AAMI's members, it's, I think, important to remember, because when we normally talk about AI, we're talking about medical devices driven by AI. But in this case, these are going to, I guess the overlap here is going to be, there are going to be programs, there are going to be predictive models that are implementing health records and then working with a medical device. So it's going to be two different regulatory pathways.
Right. Right, and I think it's just, again, the FDA has been working on a number of guidance documents, and when you look at those guidance documents, like the predetermined change control plan for medical or machine learning devices, the pre-market submission for device software functions, when you look at these FDA documents, and then you look at some of the requirements that we've got in HTI-1 for both transparency on the data and the performance, as well as requirements for risk management, you will see a lot of overlapping and consistent and complementary concepts and ideas. And so the hope is that an organization, an entity that says, you know what, I want to develop a predictive model, and that predictive model meets the definition of medical device as far as the FDA is concerned, we are, our hope is that that entity can fulfill multiple requirements, be they for demonstrating effectiveness and safety, or in providing transparency to users about how the model ought to be used and how it was trained and evaluated.
Excellent. That's very good. And every time we talk about final rules, regulations, things like that, the number one question from our side, AAMI's side, is, okay, how can standards help?
Right.
Are you looking into that? Do you have your eyes on anything in particular?
Yeah, in fact, I'm fairly certain that we actually cited one of the draft standards that AAMI has been working on in the proposed rule as being an example of the kinds of process standards that we're going to need. And I think at the end of the day, what we are going to require is that a developer of certified health IT, which is essentially an EHR developer, that supplies a predictive DSI as part of their technology, they're going to have to give users access to 31 data points, metrics, and descriptions. We have come up with the categories, but we're reliant on organizations like AAMI to help fill those categories in. And so when we think about steps that were taken to root out bias or to address risks related to fairness, we need organizations to kind of think through what are the process standards. And when we think about some of the more kind of performance-focused data points, when you sit there and say, all right, tell us how you validated this in a external data set from the training data set, or how is this validated in a local setting? Right. Again, we're going to depend on organizations like AAMI who can develop these really high-quality, ANSI-accredited, and robust standards so that we can start to make demonstrable progress on ensuring a minimum level of fairness, appropriateness, effectiveness, safety. So
that's good, and that's always our call to action. If you feel like this impacts you, get at the table, be part of the process, because it sounds like you need to hear from developers and users.
100%. The standards development community that exists in the health IT space and in the medical device space is absolutely vital to the work that we need to accomplish. And quite honestly, we can't do it on the government side, both literally and figuratively. There are prohibitions on the government developing standards that ought to be developed by industry, and I would say the vast majority of standards that ought to be developed are those that need to be developed by SDOs and industry.
Perfect. Jeff, I've learned a lot. I hope you've been enjoying the conference, and thank you so much for taking the time to explain everything to us today.
Yeah, it's been great, Brian. Thank you.